My name is Scott. I'm with respiratory therapy. I'm a respiratory therapist. I'm going to help you with the breathing.
Great.
All right. So have you ever used a mask for your breathing before?
No.
Okay, well you already have it in your hand, which is unusual. So this device is a device, this mask is going to fit over your mouth and nose, okay? It's going to blow some air at you, and you may find that it feels like it's kind of trying to help you take a deep breath, okay? So it's a little bit unusual feeling, but we're going to kind of take it slow and get used to it before I leave you and make sure you're totally comfortable before we do anything else, okay?
Okay.
All right. So I'm going to take my machine here. And what I would do is turn the machine on, and I would hook up the mask. And then it doesn't matter what my orders are. At this point, I'm going to start with some very low settings with anybody. So I'm going to, even though I might want to end up on 10/5, I'm going to turn it down to like 6/5. And I don't need an order to do that. I'm just getting the patient used to it. So once it's hooked up and I've got some general idea about where I'm headed, I'm going to hand you this. I want you to just hold on to that. Can you tell that there's some air coming out of there? That's oxygen. That's not going to hurt you. And you can go ahead and just kind of set that in your face and take a breath. And you might notice that it's sort of pushing a little bit of air as you breathe, okay? That's what it's supposed to do. Just breathe normal. You don't have to breathe any fancy way. Just make it comfortable.
Like a swimming pool.
A little bit, yeah. So you just keep breathing. These straps here go around the back of your head, and then they clip in, and we're going to make some adjustments to make sure that it fits fairly securely, but I'll also show you how to take it off if you need to, okay? I don't want you to feel like you're trapped in there, okay? Doing okay? Mm-hmm. Okay? All right, well, let's try this. So this goes along behind your head, and then this clip comes around this side, and this clip comes around on this side. And then what we're going to do is I'm going to just real slowly kind of pull these taut. And then like so. And then I might adjust. There's a couple of ways to adjust this. So clip that in there. And then I'm going to pull that up to your forehead. Does that feel okay?
Yeah.
Not too tight? Okay. So yeah, you feel like it should just kind of sit there. And so I haven't even paid attention to the machine. I don't care. I might hit alarm silence a couple of times, let it scream, whatever. I know what I've done here. I set some settings. Once she's in here and she's breathing a little bit, I'm going to get it kind of start to ramp it up so that you can start feeling what it actually feels like. And then when I get kind of stabilized, then I would go in and set my alarms. So as you feel it's kind of helping you breathe a little bit, I'm going to turn up the pressure a little bit. So you're going to feel a little bit more of a push when you breathe in, okay? So we're going to go up maybe by 2, go from 6/5 to 8/5. Just kind of breathe easy. You don't have to fight it. Just let it help you breathe. Let it help you take a deep breath. Okay.
Is it in ST mode?
It is, I think. Yep. Okay. Okay. I'll go up a couple more. So now you can see on the screen here that we have, number one, we have some alarms going off I got to fix, but also I've actually got this set up so that there is no leak essentially, but now we have some triggering, that number is going to kind of set itself, and we got a TIT tot number of 30%, which is appropriate. So let me go into the alarms, and I'm going to turn my high rate up to, like, she's doing 17, so I'm probably going to turn this up to like 25. My low rate of 8 is okay. My tidal volume is 911, so her tidal volume is 911, so I got to turn it up above that. So probably go up to like 1200 or something, which seems high, but yeah, she's healthy.
Is that her real tidal volume plus the
pressures involved with the V60?
It's being augmented by the V60, but yeah, that's an
She
accurate.
would
It
have
should
like a tidal volume of like what, 400?
probably. So we're gonna lower your CO2 down to about 7. Okay, so so the low tidal volume, I'm gonna, I don't know, 300 or so. High pressure of, so currently our pressure is 10, maybe 15. I like kind of round numbers. LIP, that's fine. Low minute ventilation, current ventilation is 15 liters a minute, so 1 point something is a little on the low side. I'm going to go up to maybe 5. And then reset, and that should be okay. I always hit alarm reset and alarm silence right after the bat, just in case something immediately goes off again. And then I watch. How you doing? So you're kind of, you're not, you're, what's that? It is hard to talk because it's blowing at you. Every time you take any sort of breath, it's triggering, so. Just take a few big deep breaths. Let's see if we can get that patient trigger number down to up a little bit.
Put my patient trigger out again. Never said.
So it takes a while to kind of re-average the numbers.
Because she is breathing on her
She
own
is,
entirely.
but not very quickly.
Oh, okay.
Because she's got super cardiac muscle.
Now
it's
we're
going
really going
up.
to lower your
Pass
CO2.
out.
Okay. So
Pass out.
Okay.
I don't think we do MVV on a V60.
no, on a V60, right? Okay, so let's just before I take it off here, let's do this. Oh, by the way, I told you how to take it off. So reach up with your hand. You can grab these clips and pull them forward, and it'll come off. Okay. There you go. And that's how you would do it if you needed to. Okay.
I don't know if I hold my breath.
It'll try to deliver a breath.
Try
it.
it. Low minute ventilation.
So your tidal volumes have dropped off to basically just the mask, and you're not. It's not going to breathe for you. But
Breathe,
it's
Katie,
trying.
breathe.
I'll save the patient.
That's great.
Okay.
Awesome.
I want you to feel the difference between BiPAP and CPAP. So let's just do a CPAP straight of 8. Now, you'll notice that it's not blowing at you when you breathe in. It's just one pressure.
So when it says spontaneous, that's her. Right?
Mm-hmm. And there you go.
Beautiful. How fun. So mask comes off first.
Stop.